Yes. Akanksha, you can start.
Yeah. So, ladies and gentlemen, a very good evening to everyone present here, and good morning, everybody in the US. So, I welcome you all to the last session of the Grief Management Training Series, run in collaboration with India and MAP. So, we've had two wonderful speakers in the last two sessions, and now I welcome our speaker for today's session, Ms. Summer Collins, who's a trauma care expert. She's a very celebrated and degreed, and we are lucky to have her today as our speaker. So this session will focus on practical tools for managing and processing grief, even during these challenging times. So before proceeding further with the session, I would like to speak a few words on MAP. So Mental Health Action by People, MAP, is an NGO that aims to promote well-being and quality of life of fellow men by proactive interventions in community mental health. The MAP is registered as a charitable organization. It has several projects on mental health at national level and having its chapters in all states. So MAP is also a growing platform for connecting people, networks, and organizations for sharing resources, for building knowledge related to mental health and psychological support, both in emergency settings and in situations of chronic hardship. So MAP aspires to building and shaping good practice in support of people affected by difficult events or circumstances. Moving on to the session, now I would like to introduce Ms. Summer Collins. So Summer is a doctoral student at University of Tennessee Knoxville, focusing on how trauma influences our connections with others. She's had careers in public policy, nonprofit administration, and finance before returning to graduate school. Summer is passionate about reconceptualizing self-care from a list of unattainable luxuries to the basic care and feeding of all humans. She's also actively involved in advocacy for veterans, survivors for intimate partner violence, and animal rights. So, for the audience, if you have any questions during the session, you can put them in the chat. We can discuss at the second half of the session. So let's begin with today's session. Over to you, Summer.
Wonderful. Hello and welcome.
Yeah, sorry to interrupt, Summer.
Yeah.
So I would like to invite someone from India also, because this program is in association with India NGO. If somebody wants to introduce, Nandur, Uma is here. Uma or someone. Yeah, you are on mute. Mute. Please unmute. Yeah.
Okay. Hello, everyone, and welcome. Sorry, Summer, for the interruption.
That's fine.
Thank you for giving us space to share about India, Dr. Tarlochan. So welcome, everyone. We're so excited that you're part of this grief training series. This is the last in this 3 session, and I'm so excited for Summer's presentation. As part of India, we started as an organization to provide psychological first aid and mental health supports to individuals who were affected by the COVID-19 pandemic, particularly like we were looking at essential workers and frontline workers in India when the COVID-19 pandemic kind of was really, really bad. And since then, we have morphed into providing support and any kind of collaborations that we can have with mental health organizations and agencies like MAP to help support their work or to collaborate and to move mental health forward in India. So we're very excited for this collaboration and truly grateful to MAP for creating this room and space for us. And we're very thrilled that you would be interested in this topic and willing to participate. And thank you for joining us.
Thank you. So now over to Summer and Akanksha. Please carry on.
Wonderful. Wonderful. Well,
Yes,
thank you for those great introductions and for the introduction about both MAP and Endear. So jumping into today, I'm going to be asking for a lot of participation. And you have 3 different options for how you want to participate. One is I'm going to be dropping a link to a worksheet in the chat for you. It's a Google Doc, so you will need to download it once you've clicked on the link. So that's option 1 if you want to participate just kind of on your own. Option 2 is if you want to participate anonymously or uncomfortable with sharing potentially some kind of personal information publicly. There is a way of doing that, and I'm going to drop the link for that in the chat as well. And that is through a website called Poll Everywhere. So that's going to, throughout the presentation, ask some questions. So this is better if you have a phone to be able to be doing this on, or if you have a, are able to manage multiple windows simultaneously. And then the last option is dropping information in the chat. So when I'm asking for personal experiences, perspectives, please feel comfortable to be sharing. That's exactly what I want, because the idea behind this is to get a wide variety of what people already do and what's working for you or not working for you for self-care, so that we can all see some different ideas and different options. The first thing I would like, if people can feel comfortable sharing what your job title is, to give me an idea of what your background is, what field you're in, because that'll help me kind of tailor the presentation a little bit. If you are mostly mental health professionals, then I will potentially not dig as deep into kind of the weeds on the mental health stuff as I might otherwise. Does everybody have access to the chat to being able to share? Okay, good. Some people are being able to. Wonderful. So grief in the time of COVID, we've been talking over the last week about grief in general. Urmi gave us a great overview of complicated grief and what grief looked like in New York City during the peak of the COVID-19 pandemic there. And Nancy gave us a wonderful overview of what grief looks like, particularly for healthcare workers, and what different societies have done to be able to address grief, what sort of rituals we have as it relates to grief. So me, sorry, most of this information has already kind of been provided for you about me, but the one thing to know is about why I care about self-care and why I have started talking about it a lot is I'm now in my 4th career, and the reason is because I get into a career, I work really, really hard, I pour all of myself into it, and about 3 years into it, I hate everything about it. Keep experiencing burnout over and over and over again. The first few times I kept thinking, oh, it's the career, I just needed a different career. By the 3rd time I realized it's me. There's something that I'm doing or not doing that's leading to this process of burnout and just being angry and grumpy and hating every part of the work that I was doing that a couple of years previously I'd been really passionate about. So we're going to talk about some different aspects of self-care today. We're going to talk about kind of what we already think about self-care, what sort of preconceptions we have. We're going to talk about why grief is related to self-care, why self-care is necessary, why it's so hard. We're going to talk about some different tools for conceptualizing self-care, because I find that having hard tools makes it a little bit easier to be doing this kind of work. We're going to talk about developing a culture of self-care within our families, friend groups, work environments, and then looking at flexibility, the importance of viewing flexibility over failure. And we're going to kind of step back, and we're going to bring all of the information together from all of the places, from all of the talks, to be looking at how we rebuild in grief, how we rebuild to have more stronger, resilient systems and practices to better serve us in the next crisis. So again, that link for anybody who wants to participate anonymously is pollev.com/palmwinds738. So the first question is, what comes to mind when you think of self-care? What sort of activities come to mind? Maybe what emotions come to mind? What kind of comes up for you as you're thinking about self-care? Exercise. And if you feel comfortable and want to unmute yourself and share your own personal thoughts, you're also welcome to do that. I will be keeping an eye on kind of hand raising. So if anybody is wanting to do that, just do the little hand raising icon and I will call on people, I guess. It's the best way to handle a large group of participants. So peaceful time with coffee, loving yourself unconditionally. Oh yeah. Meditation, positive thoughts. Yeah. Okay. Doing what it takes to get up and go. Yeah, absolutely. So for me, when I started this process, when I started thinking about self-care, my brain kind of went into overload because I started to feel anxious, thinking like, how am I going to add one more thing into my day? How am I going to add all of these things that I've got to do for self-care into my life? And particularly in the US, self-care is often conceptualized as something you purchase. It is a massage. It is a fancy bath bomb. It's something you buy. And as a graduate student, I don't have the means to do a whole lot of buying in life. And it's another thing that I have to do. I have to go out and I have to buy the thing. I have to spend the time for it that I just don't have. And so thinking about self-care in terms of kind of what some of you all are already thinking about, taking care of emotional and physical needs, meeting basic needs. So you all may be way further in this process than I was when I started, because it sounds like your concepts of self-care are way more realistic than mine were. All right. So next slide. Why is it not moving on to my next slide? There we go. There we go. All right. So when we think about self-care, we kind of want to start from the bottom of Maslow's hierarchy of needs and move our way upward. I like thinking of Maslow's hierarchy because it's an easy thing for me to remember. For those of you, I assume many of you might be familiar with Abraham Maslow. He was a psychologist in the US in the 20th century. He was the son of Jewish immigrants from Russia who fled persecution. And that was really important to a lot of how he saw the world and a lot of his theories and philosophies about human functioning. He had a strange relationship with his mother because she wasn't a warm person. She didn't connect with him. And he believed a lot of that was because her hierarchy of needs was unbalanced, because she was still fearful of not having safety, of not having food, of not having access to things because of her history of persecution and having to immigrate to a new country. So when we're thinking about self-care, we kind of want to start focusing on the bottom of this pyramid and moving our way up. So things like self-care through art can be great, but if you're not getting enough food and sleep, self-care through art is not going to be what you need to take care of yourself. It's not going to provide you a sufficient refill to be able to kind of keep you going and doing the things you need to do. So Ormi provided us a great overview of complex grief, complex bereavement, and what the diagnostic criteria is for that. I wanted to bring it back up to emphasize the point that grief is stressful. That's why we're talking about self-care with grief, because grief takes so much out of the body. There's even a phenomenon called Takotsubo cardiomyopathy. In the US, we call it broken heart syndrome, where during periods of intense stress, intense grief, our hearts actually like physiologically change temporarily. So grief is hard on the body, and the responses to grief are quite similar to trauma responses. You tend to find intrusive thoughts. This isn't fair, this isn't right. I wish, that my loved one was here and maybe I wasn't the one that was here. We tend to find avoidance of emotion, avoidance of situations that kind of trigger those emotions. And then also a failure to adapt to the new reality that we don't want to accept, that our systems failed us during the pandemic and that it hurts that we are going to have to do things differently from now on. We're not going to be able to trust the systems in the same way that we used to. So stress is hard on the brain, on the body, on our relationships, and there's a whole lot of negative effects of stress. Now, I can give an entire presentation just on stress. I'm fascinated by stress. I'm fascinated about kind of the positive sides of stress, eustress, and the negative sides of stress, distress, and kind of what that continuum looks like for each individual person. But today we're primarily focusing on this distress because we find distress most tightly associated with grief. And when we're looking at self-care and stress, self-care has a negative correlation with our perception of stress and psychological markers of stress. So the more self-care we're participating in that's effective for us self-care, the lower our perceived stress is and the lower our physiological markers of stress is. Also, the reverse. So if we're not doing such a good job at self-care, we're likely to see higher levels of perceived stress. And that perception of stress is really important to the actual experience of stress. So I'm a grad student. I'm going to put my nerd and research hat on for a moment and talk about why this is so important for caregivers in particular. I talked a little bit about my own personal experience with burnout a bit ago. And burnout and compassion fatigue are really, really common with people in the helping professions. We've got mostly mental health folks here. It looked like we might have a few physicians here. So you may be familiar with these terms already, but I want to make sure that we understand the differences between burnout and compassion fatigue. Because burnout is defined as a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. And this tends to reduce our capacity to do the things that we want and need to be doing, both in our personal life and in our work life. And this tends to be as a result of long-term exposure to stress. One difficult weekend is unlikely to lead to burnout for you. But a pandemic that goes on for a year and a half, 2 years, who knows how long this is going to keep going, probably going to put you at increased risk for burnout. We know it's going to put you at increased risk for burnout because since the pandemic started, over 50% of all hospital staff researched in India are experiencing burnout. This includes physicians, this includes administrators, this includes people who are cleaning the hospital, everybody. Half of everybody who works in hospitals are experiencing burnout right now. In general, pre-pandemic, throughout a career, physicians experience burnout at a rate of about 50%. Medical students experienced burnout at 80%. So there's something about medical school and kind of how we do medical school. This is very similar to this data we see in med students here in the US. So there's something that how we do medical school that is very stressful, very likely to lead to burnout. Factors that we see relating to burnout or that increase the risk of burnout: work drain, working really long hours, not being able to take time off, kind of having your personal life interrupted by work, whether that's being called back into work or just constantly thinking about work. Lack of morale, not feeling like you are in this together with colleagues, with patients. And then neuroticism. On the whole, in helping professionals, we tend to have a slightly higher level of neuroticism to begin with because we're very focused on the details. As mental health professionals, we're constantly paying attention to little details of what clients are telling us or what they're showing us, if they're constantly fidgeting or if we notice that they're suddenly like tensing up at something. Surgeons certainly are going to be high on that neuroticism scale. And when we add additional stress into life, like a pandemic or like any general life stress, we tend to see increases in base levels of neuroticism in individuals. Compassion fatigue, being slightly different, is a diminished capacity to care about individuals, whether that is patients, whether that is family. It's just kind of a loss of that inherent caring that we as helping professionals have. So we see compassion fatigue pre-pandemic in about 50% of all nurses in India, and worldwide, about 91% of all hospice nurses or any sort of end-of-life care, because that looks pretty different from country to country, are showing significant risk factors of compassion fatigue. And some of those risk factors that we're looking at are a sense of powerlessness, that we don't have the ability to affect change. In this case, it makes some sense why folks who are working with people in the end of life might have a sense of powerlessness, that they want to change things for them. They want to help cure their cancer. They want to help make sure that they have family around them, but they don't have the power to do that. Again, coming back to work drain, overwork, long hours, not being able to separate work life from home life. Lack of self-awareness. Usually this comes because we're not taking breaks when we need to, or we're not able to take breaks when we need to. And we're not kind of aware of our own needs and making sure our own needs are met. Also, folks who have a history of trauma are more likely to experience that compassion fatigue. All right, so I'm kind of talking fast here. I want to slow down for a moment, both for myself and for you all, and think about some of those barriers to practicing self-care in our lives. What are things in our daily lives that make self-care hard? The biggest things that tend to come up are time, modeling, that we just don't have people in our lives who are doing this, so we don't really know what it would look like. We weren't taught as kids. And self-perception. As helping professionals, we are much more likely to see ourselves as competent, as capable, of helping others, not of needing help ourselves. So some folks are providing some responses: urgent work, absolutely, uncertainty, kind of the situation, having mental space, acceptance, absolutely. Things that can make it harder for us to practice self-care in our lives. Yeah, school assignments. A fellow student, I understand this. So in order to kind of start figuring out how we can really do self-care, how we can let go of these preconceptions that we have and find ways to do self-care in our lives, as crazy and hectic as they are, with as many factors as we have going on. That may be family, that may be hobbies or volunteer work, it may be work, it may be school, it may be 1,000 different things. So we're going to wipe all of those preconceptions away. We're going to look at two different ways of reimagining self-care. The first one is visual. I am a highly visual human, so I like this method of conceptualizing self-care. The second method is for people who are not visual and who are much more numerically oriented. That's not me, but there are a lot of people like that. So we're going to show two different ways. We're also going to talk about stigma. Thank you for bringing that up. Stigma of self-care as it relates to selfishness. So the first visual way of considering self-care is through what's called spoon theory. So this was developed by an individual who experiences a chronic illness and was a way of communicating how difficult, how much energy, how much more energy things take for her than for other people. It's kind of taken off, and a lot of people have taken on spoon theory as their own, and it's used pretty widely as a tool for conceptualizing and communicating self-care needs. So everyone is going to have some things for themselves that take very little spoons. That may be kind of getting up in the morning and brushing your teeth. That may be sitting down and watching TV. And everybody's going to have things that take a whole lot of spoons. So for me, that is doing the dishes. I don't know why doing dishes takes a lot of spoons for me. For other people, there may be other factors of kind of what goes into what takes additional spoons for you. But the one thing that I really like about spoon theory is it's an easy way to communicate. My partner and I use spoon theory, and I will frequently say like, hey, I'm running low on spoons for today. This thing that we've been talking about doing, can we move that to tomorrow? And he understands why I need to be able to move it to tomorrow. And it's not that it's not important to me, and is willing to respect that I'm recognizing my own needs. And he is able to communicate in much the same way. It also works really well with kids. So if you want to incorporate self-care into your family and you want to work with this with children, and you don't have to use spoons, you can use anything that feels appropriate to you and your family. But finding a visual tool to be able to communicate for a kid to say, especially after school, children tend to kind of be low on spoons for a little while until they can refill, that they can tell you, hey, I'm low on spoons. And that will tell you that, oh, this kid isn't acting out, is not misbehaving because they are just wanting to misbehave. It's because they need more self-care. They're pretty low on those spoons. So we need to focus on kind of building that back up so that they can do the things they know that they're supposed to do. So for the numerically oriented people, we have a spreadsheet, chart. Spreadsheets and charts are sometimes lovely in my life and sometimes overwhelming. So if you get overwhelmed by spreadsheets and charts, focus on the visual. But getting an idea, and I like to start with kind of a base of 10 or a base of 100 to see how much kind of different activities are draining for you and how much they're refilling for you. So some things that might be draining: getting dressed from work, probably not terribly draining. Giving a patient's family bad news, probably really draining. Things that might kind of provide little refills would be like kissing your kids goodbye in the morning. Might be a nice little refill. Seeing a friend you haven't seen in a while, even if it's from a distance, just kind of, hey, it's good to see you. And I recognize that like yelling across the street, waving may be a very American thing. I don't know how you all would feel comfortable connecting with a friend from a distance for a brief moment that you haven't seen in a while, but whatever that looks like. And, you know, finding kind of ways to build that back up. Now, some of the things we're going to notice as we're looking at what takes a lot of spoons, what gives a lot of spoons, is that we have in our day-to-day life a lot of the little things. In our day-to-day life, we're not going to get a ton of the big refills. The big refills tend to be like huge connecting opportunities. So like family weddings tend to be a big refill for people. We haven't been able to do weddings in the way that we normally do for a long while. But still those kind of opportunities for connection tend to be big refills. So we got to focus when we're looking at self-care on the little things, day-to-day things that we can really access in our lives. On the energy drain sides, we're probably going to have some big ones in our days. And we're probably not going to be able to plan them or anticipate them. And that's hard. But that's why when we have the tools and know what helps to refill us, if we know that one of those big energy drains is coming, we can prepare. And if we are kind of afterwards noticing that we're pretty low, we can take some time, little bits of time, to be able to refill ourselves. So I'd like you all to think of, usually the biggest and easiest thing to think about is, what are our big drains? What takes a lot of energy out of you? What experiences throughout your day or in your life in general have just kind of afterward left you needing to sit down for a while? Some of these things include regular things, like sitting in traffic while driving. Some of these things include really big things, a loss of a family member, a parent. Money stress can absolutely be a big drain. Conflict, interpersonal conflict, whether with family, with colleagues, or with patients. We're certainly seeing, we saw a lot in India and hospitals and clinics of patients in grief getting aggressive, getting violent, or the family members of patients getting aggressive and violent with health professionals. And we're seeing that here in the US as well. We've recently had to get a security guard at work because we had patients who were becoming aggressive with our health staff.
Summer, we have some responses coming up in the chat.
Yeah, thank you. I'm seeing those. So we're seeing overload at work, talking about feelings. Yep, especially if it's stigmatized to talk about feelings and we don't have the language and the tools to be able to do that, that can be really draining. Yeah, interactions with people who are highly rigid and highly critical, especially in situations probably where you don't have power, where it's an unequal power dynamic with that individual. Getting dressed and cooking meals absolutely can be just exhausting for some people. And the day-to-day of having to cook every day and think about what we're going to have for dinner tonight can take a lot out of people as well. Yeah, so the idea behind Poll-Ev is for folks who want to be anonymous and don't feel comfortable sharing their responses in the chat. I recognize, because some of these things are highly personal, that some people might not feel comfortable with that. So if you would like to respond anonymously, you can go to pollev.com/calmwins738. And throughout the presentation, every time I'm pausing to ask one of these questions, that question will pop up for you and you will have the opportunity to respond in an anonymous way. If nobody wants to respond in an anonymous way, that's totally fine by me. I'm used to working with students. And so I teach as part of my duties as a graduate student. And sometimes when students are communicating with one another, especially about personal things, it can get uncomfortable. So they tend to prefer having an anonymous way of doing that. And teaching online to elementary students, elementary school. I was also, previous job, I was a substitute teacher for a little while. And teaching elementary students and keeping their attention when you are sitting face to face with them is hard enough. I have so much respect for folks who are doing that online, because I don't know how you do that. So yeah, one of the things that's really hard as helping professionals is not having the ability to fix our patients' problems. One of the things that Nancy was talking about is the benefit of sometimes just sitting with somebody in their pain. That's hard. It's really hard because we're fix-it people. We want to fix the problems. And sometimes what they need is for us to sit and to be there in that pain with them. And that takes a lot out of us. So now that we've looked at the really big drains, what are some of the little things that you know about yourself that kind of get under your skin? Some common things that people might experience are things that your coworkers, colleagues, or family members do that just irritate you. So it could be leaving trash on a countertop. It could be not closing a cabinet or a drawer when they're finished with it. It could be leaving dirty clothes around the house. There are also some day-to-day life things that can be little drains that we deal with. Sometimes, as we talked about with cooking dinner, having to think about what to cook every night, having to take the time to sit down and eat, or doing the thing that some of us do and like shoving food down between seeing patients, which doesn't lead to giving us to enjoy food. So little drains, peers discouraging you, absolutely, not having a supportive culture, bad bosses and supervisors. I'm frankly surprised to hear this is a little drain. So this is a great example that what for some people will be a big drain, for other people will be a little drain. For me, having a bad boss or supervisor who is not attentive, big drain for me. So for some folks, that might be more of a little day-to-day thing. Not being organized, yeah. And also sometimes having a belief that we should be super organized. So we're seeing some of these little things that are coming up for us day to day. If you are following along in the packet, the worksheet packet that I dropped at the beginning of the session, there are places for you to be kind of writing these things and to also go back and reflect on it and add things over the next few days as you're further thinking about what some of your drains are. Yeah, colleagues not doing their part. Absolutely. Again, coming back to that, not having a supportive culture. So we've kind of now been thinking about what takes energy, mental, physical, emotional energy out of us. And now we got to start thinking about what adds it back in. What are these refills? Whoops. So on the whole, refills tend to fall into 3 categories: people, places, and activities. So who are we connecting with? Under what circumstances? What feels good? What feels draining? Places. Are there specific locations that we go to help refill? Whether these are like vacation places that we go to occasionally, but more specifically, what are the day-to-day places? I've had places of employment where sometimes I had a specific closet that I would go to throughout the day when I started to feel super drained, to have a couple of minutes alone without other people around. And even though it was a little broom closet and there was like not much space for me, it was a place where I could focus on taking care of myself. So that for me was a refill place. And what are ways that we can enhance our environments? So that may mean changing out lighting in our office if we can, going with lamps instead of overhead lighting if overhead lighting is overwhelming to us. So thinking about those kind of different ways we can impact our environments to make them less draining and to make them slightly more refilling for us. And then activities. Activities are usually what we think about when we think about refills. But we also want to think about, like, are they brief? Are they things we could do real quickly? Or are they time consuming? And are we doing them by ourselves or are we doing them with others? And does that impact the level of refill for us? Somebody's saying their sketchbook, probably both a place and an activity for you that is great for refills. So when we're thinking about activities and how to kind of start from the ground floor, which you all may not need the ground floor. It sounds like you have some pretty good ideas already of kind of how to enhance your self-care. But since we've mostly got mental health professionals, this is important to think about when working with clients, when we're working with patients, about how to teach them how to do self-care for themselves. We want to start with eating, sleeping, moving, and connecting. We're meeting those base 3 levels of the of Maslow's hierarchy of needs. Eating. Are we eating often enough? That may mean smaller meals throughout the day. That may mean 2 or 3 larger meals. But are we eating often enough for ourselves, or are we noticing that we're getting irritated, angry, hungry, that we might be getting physical symptoms like headaches because we're not eating often enough? The quality of the food. Are we eating things that taste good? And are we eating a variety of things? So one of the things that is kind of a go-to in the US that people talk about when you're stressed, stress eating is usually sweet things. Sweet things are great, they're tasty. And also, we can't eat them all the time. We gotta have a variety of things. And any single item that we might be going to very frequently, we need to have a variety, both because that provides some stimulation to our brain and some novelty to our body to be able to have these different experiences. And nutrients are supposedly important. I'm not a nutritionist, so I will trust people that tell me that there are different nutrients and things that I need to be paying attention to. And then having opportunities to savor food. Again, coming back to if we're shoving down a quick meal between seeing patients, we're not paying any attention to what that food tastes like. Sometimes that's good because we're not eating things that are particularly tasty. But taking at least a moment to savor our food, to identify, do I even like this thing that I'm eating? Do I want to eat more of it? For me, every single morning, you've seen me a couple of times drink my cup of coffee. Before I have my first cup of coffee, I smell it because I like the smell of coffee and it brings up happy memories for me. And then I take a sip, I enjoy the sip, and then I can move on and rush through my day and do all of the 10 million other things I need to do. But I took 2 seconds, and that actually helped me to enjoy my coffee and enjoy my morning a lot more. 2 seconds. So that's a thing that most of us can find some time to do. So I like savoring because it's super accessible. We've got to be eating, we've got to be drinking something throughout our day anyway. So taking 2 seconds of that time to really focus on it and enjoy it can add a lot to our day, especially if we're doing that repeatedly. Sleep.
Summer, we've also got responses like sometimes random shopping is our refill, creativity, painting, singing, and true buying vegetables is refilling.
Yeah, ooh, okay, buying vegetables. I love buying vegetables. And then I have to think about cooking with them, and I sometimes get overwhelmed. But yeah, buying things. So I'm going to kind of put that grad student research hat on again for a moment. One of the things that when we purchase things, it does in our brain is it gives us extra dopamine. Dopamine helps to kind of give us pleasure, give us some happiness. And so absolutely, those little shopping trips are great. But when shopping is the only thing bringing us dopamine, that's a big problem for our pocketbooks. It's a big problem because we can't always just go shopping to be happy, and we don't want to always have to go shopping to be happy. In the US, during especially the early days of the pandemic, shopping for random purchases on Amazon.com skyrocketed. And that was because a lot of people weren't getting their dopamine hits from other places anymore. And so add to cart, that little button was so tempting, and it gave us little dopamine hits. And then lots of us realized how much money we spent on Amazon real quick. Cooking, trying out different cuisines, different recipes, absolutely. Adding that sort of creativity in is great for giving us that variety that's really important for us nutritionally, and also really important for us psychologically. And it can be fun. And it can be a connection activity to connect us with family members, with friends. If it's a friend who's given you the recipe, that you can then let them know, like, hey, that was really good. Thank you for sharing that with me. Or I made this change. You might consider trying that next time. Yeah, but not having to do the dishes later. Absolutely. Again, for me, dishes are a big drain. So coming back to sleep, in the US, and it is fairly ubiquitous, but I could not find good data on sleep studies in India. We don't get anywhere near enough sleep. On average, we're getting about 5 to 6 hours of sleep a night in the US. That's not enough. we need as humans for basic physiological functioning somewhere between 7 and 10 hours. Some of us, rare people, have no physiological problems with sleeping 4 to 5 hours. Those are very, 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 very rare people. You are probably not one of them. I am definitely not one of them. So in addition to looking at the amount of sleep we're getting and making sure that we prioritize getting good sleep is also quality sleep. If we're taking the time to make sure that we can sleep for 8, 9, 10 hours a night, we want it to be good quality sleep. We don't want to be wasting that time. So finding ways to enhance that sleep. And in the packet, I include information on basic sleep hygiene. So how to enhance your environment for kind of optimal sleep. And we also want to look at things that help make sleep a little bit easier, make you feel a little more inclined to go to sleep. So that might include things like bedtime routines. It might include things like making sure that you make your bed every morning so that you are pulling back the sheets to climb into a freshly made bed every evening, if that is a good refill for you. And then frequency. Some people do really well with naps and little naps throughout the day. Some people don't. I don't know what's going to be the case for you, but if you are a human who takes a 20-minute nap at 2 o'clock every day and feels great thereafter, do that. Build that intentionally into your schedule. If you are a human who cannot take a 20-minute nap and has to take a 3-hour nap, you might not want to build a nap into your schedule. You might want to focus more on getting more sleep the night before. And then the general environment, as I said, with the sleep hygiene, things like light in the bedroom, things like noise that could be accessible to you in the bedroom. Moving. We as humans are designed to move in some way. It seems that we are being told increasingly that moving has to be unspecific way. We have to go running, we have to go to the gym, we have to, whatever it is that our culture is telling us at the moment, is the one and only way to move properly. We just gotta move. So finding ways to move that feel good to us, that we want to do and we want to do more frequently, and that we have access to is important. The goal being to do enough movement that at the end of the day, our body feels physically tired, not exhausted, not I cannot move anymore, but you know, that kind of like feeling in your muscles of, yeah, they're a little sore, I'm a little tired, and when I lay down, I can fall asleep. And then the environment that we're moving in. For some people, they enjoy going to a gym. I find gyms smelly. I find them stressful and overwhelming. And that is not a good environment for me to be moving in. I like being outside. I like being in water. So finding ways to move in that way works great for me. And we can find ways of moving in just our daily lives. One of the things that I started with my cohort of folks who started our doctoral program at the same time was a dance break. That on Zoom, between classes, because we usually had just a couple of minutes between our classes on Zoom, I would turn on a song and we would turn off our cameras and we would dance and we would be silly and we would hear each other laughing. We wouldn't see each other because that made us self-conscious, but finding ways to just move, even if it's just dancing a little bit, even if it's just being silly. You may notice that I am standing instead of sitting. When I am talking, I do better standing. So that adds a little bit of extra movement. I also move my arms and hands a lot. Music is important. Yeah, absolutely. Getting into the kitchen. Yeah, absolutely. And behavioral activation. Yes. So if we're going to get super technical, behavioral activation is what we're looking for. Ways of being able to enact those behaviors in our daily lives. And then connecting. This is the thing that the pandemic has robbed most of us of the most, is connection. we are used to seeing our friends, our patients, our colleagues full face. Now we only get to see this much of them when we're in person. And we are used to being out in the world, seeing people, saying hello, spending time doing activities together, spending time in communal rituals, whether that is just regular rituals of I'm going to work, I'm getting on the bus and I see all of the other people on the bus that I go to work with every day, or whether they're kind of irregular but important rituals to our lives, like, as I said earlier, weddings, funerals, family gatherings. So finding ways of connecting, how frequently we're doing it, whether we are able to find ways to safely do it face-to-face, or whether we have to do it digitally. And there's kind of a hierarchy of, in terms of efficacy, what digital connections are useful. Things like Zoom, where we can see each other face-to-face, tend to have the greatest efficacy. After that, we're looking at phone calls, texting, and then at the very bottom is social media connection. It feels good for the moment, but the moment you've turned it off, that sense of connection is lost. Taking time to connect with yourself as well. Absolutely. Thank you for bringing that up. That is really important as part of self-care. Using karaoke. Yes. Love karaoke. In the US, we tend to do that at bars and in public places. I haven't been able to do that in a very long time. But yeah, music, keeping the body and the cells in the body active. I could also give an entire presentation on music and music therapy, like how our body and how our brain respond to music is so cool to me. But yeah, music is really important. Yeah, and so absolutely, we have gotten really good over the last year and a half at getting better at paying attention to expression through eyes, and also at communicating with our expression through our eyes. However, that is also really tiring because our brains and our bodies are not naturally attuned to that. We're slightly attuned to it, but we're not hyper focused on it naturally. We've had to develop that skill. So that's taking more out of us, even though we're getting better and better at it. So once we get the basics of self-care down, we can start expanding out into other types of self-care. We can look at emotional self-care. We can look at financial self-care. Somebody said that one of their big drains was money. Absolutely. So finding ways to maybe build a budget and having that be a fun thing. And maybe it's something you involve your family members in. How much can we save this month? Oh, we were able to reuse some leftovers instead of having to buy new meat for dinner tonight or new ingredients for dinner tonight. And so we were able to save a little bit of money, turning that into a game, a connection. In work, types of self-care can include time management and setting boundaries. We're going to talk about boundaries in a bit. Boundaries are one of the biggest challenges for a lot of people as it relates to self-care, especially as helpers. We want to help. It is in our nature to give of ourselves to other people. And sometimes our culture also tells us that we are expected, especially for females, to give of ourselves to other people. And it's often modeled for us that we give and give and give until we're drained, until we're done. And that's not good for us. Somebody earlier mentioned the stigma of self-care being selfish. Yeah, it is a little selfish because we cannot be selfless without also being selfish. It's not possible. We will drain ourselves too fast to the point of that compassion fatigue, where we cannot be selfless anymore. We cannot give of ourselves to others. So yes, we have to be selfish in some ways. And we have to find what feels good to us, feels acceptable to us, as being something we take care of and protect for ourselves, and what feels like we are taking from others in that process. Yeah, you cannot feed others from an empty vessel. oftentimes in classes, I will, when we used to be able to do classes in person, I would bring a jug of water and use that and pouring into cups as my example of when that jug is empty, like I can look at it, I can bang on it, I can will it, I can tell it to put more water in it. And unless I do the work of going to put more water in, that jug is not just going to refill itself. So absolutely, we cannot feed others from an empty vessel. Learning to be assertive as a way of self-care, absolutely. So assertiveness is an important part. And what I have found for me is assertiveness is so much easier when I am better at boundaries. Because if I am just being assertive and not having a particular reasoning and a particular system set up for why I am being assertive, that for me starts to trigger more of those feelings of selfishness, of I am not kind of being the type of person that I believe I'm supposed to be. So again, we're going to talk about boundaries in a minute and dig into kind of the nitty gritty of how to set boundaries. So since we've been talking about refills, what are some big refills for us? Again, most likely these are going to be infrequent activities, things that happen in our lives, generally going to involve connection or accomplishment. So for some of you, graduating from your degree program was probably a big refill. That celebration, that ceremony was probably a big refill for you. Time with loved ones. Travel, yes, travel is a big refill that we haven't been able to do for a long time, both because of the pandemic and for some of us because it just hasn't financially been attainable for a while. But connecting with loved ones, finding ways to even just travel in your local area. Going on a picnic is a great example of kind of local travel and local experience as a big refill. Yeah, connecting with family members, especially older family members, can be a big refill that some of us haven't been able to do in a while because it hasn't been safe. Talking to others, calling others on the phone. Yeah, so again, coming back to this hierarchy of connection, if we can't see people in person, how do we connect with the people who matter to us, who are important in our lives, in ways that are efficacious, that are worth the time to be doing that? Calling and talking on the phone is a great way of doing that. Music, playing with pets, absolutely. Pets are wonderful. Again, I could probably just keep doing different lectures on all sorts of things all the time. I love talking about information and about ways of enhancing our lives. But pets do really, really cool things for us, both neurologically, physiologically. Having pets, just the presence of them in our lives is really helpful in a lot of ways. So playing with dogs, coffee, absolutely, or tea, or any sort of like warm, comforting beverage, watching rain, books, music, avoiding relationships that are having harmful effects on us, absolutely. Reaching out to loved ones, and sometimes helping those loved ones can be a big refill for us, absolutely. Gardening, connecting, being outside, connecting with the earth, doing something that feels like it's gonna grow, it's gonna change for us. And then some small refills, things that we can access multiple times a day. Somebody already said coffee. We've already said music. Little things that we can do throughout our day are really the most important things that we can be doing at the beginning as we're enhancing our self-care journey. So that could be setting like a little bit of time aside to do some leisure reading. As a grad student, I don't get to do much leisure reading. It's part of the nature of being a graduate student because I have so much reading that I'm required to do for my research, for my classes, as I'm preparing to meet with clients. But I set aside and I sit down to read 3 pages of a book per day. It, for me, is always fiction because that is something totally separate from what I'm reading normally. And 3 pages doesn't take me very long. It takes me like 5 to 10 minutes. But reading those 3 pages feels like such a selfish moment to not be exclusively reading things for graduate school. So finding some way to get your equivalent of reading 3 pages of a fiction book per day that doesn't take you much time. Allowing myself to just not do anything. Absolutely. Both giving yourself time and permission to sit and watch the rain, to sit and watch the kids in the neighborhood playing, or just to sit and breathe. Absolutely. Yeah, having, again, water is, for a lot of us, a really important thing to be like, that we get a lot of connection when we're near. So that new fountain that you've built, absolutely, sitting and watching it is a great way of having a little bit of refill that you can do, since it, I assume, is at home or maybe at work, something you can do on a regular basis. Prayer, cooking, naps, dancing, magazines, meditation. Yeah. Okay, so somebody said mindless TV show. Yes. And TV is great for shutting our brains off, especially things that are just really enjoyable and mindless to watch. And also, for most of us, there tends to be a point of diminishing returns, where one show, one episode is a refill. 2, 3, an entire binge might become a drain rather than a refill. So identifying for yourself what that looks like and kind of what boundaries you need to put around watching TV to make sure that it is a refill for you and not a drain can be really important to making sure that you're using it intentionally and that it is good for you and useful for you. Attending training programs, yay! I hope today is feeling like a little bit of a refill for you at the very least. I don't know what Hyderabad biryani is, and I'm probably pronouncing that correctly, but eating something that sounds probably delicious with friends sounds amazing. And again, these are things that we can do. You know, we've got to eat anyway. So eating lunch with colleagues, if we can find ways to do it in a safe way, is absolutely great. Expressing gratitude, connecting with friends, reading, yeah. So we've got some ideas of kind of what we can add to our days to see what level of refill they are. It's the whole reason why I'm asking you all to share, to be a little bit vulnerable in sharing, so that you can get ideas to get what other people do, because we don't talk about this very much with other people. Like, I don't generally sit down, unless I'm feeling like being a particular nerd with my friends, and sit down and talk about self-care routines. Over the last year, I've done that a lot more. But prior to that, I don't sit down and talk with my friends about that. So we don't have good models. We don't know what other people do. And especially when we are stressed, it is hard for us to think flexibly. It's hard for us to think creatively. So we're not able to kind of look and see what other ideas are out there that we might be able to try. I'm missing out. I will have to try it. Thank you for the suggestion. How can we classify big and little refills? The answer is it's all about you and what feels like just a little bit of something. For me, my coffee in the morning, that kind of 2 seconds of smelling it and really savoring that first sip. If I have lost a family member and I am going through a really big stressful period, smelling that cup of coffee once is not going to do much for me. So that's kind of what I'm using to classify between big and little, is what for you feels like a big refill versus what feels like a little refill. For me, big refills are often around connection. Playing a game with my husband can be a really big refill. Getting to see my nieces, which I am hoping I get to see my nieces in a couple of weeks. I'm really excited. It's going to be the first time in like a year and a half. And getting to do that is a big refill for me, because it's not something I get to do very often, and it just fills my spirit a lot. Taking long walks can be big refills. Going, again, for me, water is really important. So going swimming, and not necessarily like exercise swimming, but just spending time in water, enjoying nature can be a big refill for me. So it's whatever for you feels big or little, and identifying those differences for yourself. Okay, so other ways that we can kind of add more self-care into our lives without as much work and without as much kind of drain to be able to do the self-care. So somebody said creating mental space is one of the hardest ways for, one of the hardest reasons for them for why they can't do self-care. And so by creating routines, rituals, and checklists, that helps to add some mental space for us. So typically when we're talking about routines, we might be talking about something like a bedtime routine. Well, I turn off my electronics, I brush my teeth, I wash my face, I take some medicine, or I have some water, and then I lay down and I read for a few minutes. So when we're talking about routines, we might be looking at that. But we can also add routines into other areas of our lives. We could have a morning routine. And most of us have an unconscious morning routine. We might be getting up, we might be caring for kids or feeding pets. And we're not necessarily thinking about how can I do this in ways that are adding back into me, mostly because we're still a little tired and we're trying to like figure out what we're doing. If you're me, trying to just stand vertically because I haven't had my coffee yet. But if we're able to create a ritual out of our morning, create a strict routine that starts with a checklist, that we do the same thing every morning, that gives us the opportunity to be intentional about what those things are. Once it becomes routine, it becomes a habit, our brain doesn't have to think about those things anymore. We just do them. It's called habituation. Habituation is awesome when it works in our favor, and it is so frustrating when we are trying to break a habit that is harmful to us. It's part of the reason why things like smoking, quitting smoking are so hard, is because of that habituation piece. So finding ways to kind of enhance those daily rituals for us of things that we're already doing and adding in more pieces of self-care. So those 3 pages of leisure reading for me are first thing in the morning. That after I've had my cup of coffee, I sit down, I grab my book, and I read 3 pages. Because if I don't do it in the morning, I'm never going to do it any other time during the day. And that helps to kind of give me that little boost, that little refill first thing in the morning to help inoculate me for the rest of the day for the things that are going to come. So by not having to think about these things anymore, not having to wake up and go, oh, what do I need to do today? What am I doing? Being able to just kind of start with that automaticity in the morning. We create a little more mental space that we can occupy with things that are important to us. So checklists. If I don't know the couple of physicians that are in the room, I don't recall what your specialties, I don't know what your specialties are, but surgeons, starting after 2009, started using checklists worldwide because the World Health Organization did a worldwide study that indicated that surgeons who used checklists in the OR, death rates decreased by half in the operating room, just by having a checklist. It was already the stuff that they were doing, but by having something that could be reviewed, ensured that they were doing everything they needed to do, and that everybody in the room knew that they were doing it, creating these mutual expectations, helped to reduce the death rate on the operating table by half. That's really valuable for a little couple item checklist. And then it also reduced complications of surgery significantly by having that checklist. So finding ways to develop a checklist for yourself to create these routines and rituals around things that you're already doing, being more mindful and more intentional with them can be helpful to creating some of that mental space. Yeah, so somebody asked, if you're already in a low mood and nothing seems to be of interest, how do you do self-care? And the answer is starting down at the base of that pyramid and starting as small as you can make yourself do. So that may mean taking a nap. That may mean having a glass of water or having a meal. And even if it's not a full meal, finding something that you can sit and eat and try to enjoy the taste of can help to kind of start building that foundation of the Maslow's hierarchy pyramid for you, so that you can kind of move through the other levels to be able to do the things that you want to do. If you are so totally drained that you are just not feeling up to doing anything. Does that answer that question? Okay. All right, so boundaries. Boundaries are hard. Mostly because a lot of us haven't been taught how to set boundaries appropriately, particularly as helpers. We just want to keep giving of ourselves. So in the packet, I've broken this down, and I'm just going to go through the steps really quickly because we're starting to run out of time and there are a few other things that I really want to get to. With setting the boundary, identifying the target behavior. What are you not willing to engage with anymore? When that behavior is occurring, that you will ask for it to stop or you will step away. Identifying very specifically what that target behavior is really important to being able to set the boundary and maintain the boundary so that it is clear in your brain. To whom does it apply? Is it everybody? Is it one person? Is it only family? Identifying that also helps with being able to maintain that boundary and communicating that boundary to other people. Understanding the circumstances. Are there exceptions to that boundary? And for how long is the boundary going to last? Is this something temporary? Is this something permanent? So as an example from my life, my mother and I have some disagreeing beliefs on regular vaccination. And the boundary is we will not talk about that anymore. It only applies to my mom. I'm glad to talk about regular vaccination with other people in my life, but it only applies to my mom. The circumstances have changed because of COVID. We talk about the COVID vaccine quite frequently now. But once COVID is over, we are not going to talk about vaccinations anymore. And we don't talk about vaccinations beyond COVID because that's the very clear set boundary. I've communicated that with her. She understands it. So when she brings up the topic and I say, we've discussed that we're not going to talk about that anymore, she's not surprised by that. Oh, yeah, okay, we're not going to talk about that anymore. So being very clear and very explicit in kind of what those pieces of the boundary are important for you and are important for the other people to try to respect and honor that boundary as they can. Creating a culture of self-care. Lots of folks were saying that it's hard to practice self-care if other people around you are not doing the same thing, if other people are not modeling that behavior, and that is so very, very true. So we want to create cultures of self-care everywhere we can, starting within our family, within our friend group. Things that are important for that, particularly with kiddos, is having a common language to be able to communicate your self-care needs and your capacity level at that moment with other people. It gives other people the information they need to potentially step in and help. So when I tell my husband, I am low on spoons for today, can we move this activity to tomorrow? He can step in and help and say, absolutely, or let's move it to tomorrow. Or, this is something I can do myself. I will take care of it for you. Gives others the opportunity to help us in ways that we are usually helping other people. Using that common language can be used with children, especially if you're using something metaphorical. Modeling, I keep talking about this, and it's so important because if we're not seeing other people doing this, we don't know what the options are. So if we're doing this, other people will see us, will see the options, especially if we're talking and being very explicit about why we're doing these sorts of things. Within our organizations, if in your organization at work, you are an executive, you have people working underneath you, that you have some power to be able to affect these change, you can work from a top-down formula. And that would be you as an executive modeling what you want your employees to do. It means you got to actually do it, not just tell people to do it. I've worked for companies before, worked for organizations before that like to tell people self-care is important. We believe you should practice self-care. And all of my supervisors were working like 12, 14-hour days, 6 days a week. No, that doesn't work to tell people to do that and then not to do it yourself. You have to do it yourself and show people how to do it. Give people permission to do it. Because if you're not doing that, the people working under you who have less power are going to believe that they should be following your example. Providing tangible support. So that may mean helping to create a system where everybody gets to take a break once a day, where everybody can kind of lean on everybody else in the team for 5 minutes or 10 minutes per day, so everybody can get a break. Whether that means changing some policies to provide things like bereavement leave. At least in the US, if a family member dies, depending upon your work and place of employment, you may or may not be allowed to take time off to go spend time with family, to connect with family and perform those important grief rituals. And then sometimes creating incentives. And those can be little things like self-care of the month awards, just to kind of provide encouragement and continue developing that culture of self-care within that encouragement. They can also be financial incentives if you have that opportunity to do that. So if you are not in a position of power, you can work from a bottom-up perspective. And that is, again, doing modeling, peer modeling, talking with your peers about what's going on and kind of these processes that you're taking. Emotional support, supporting peers when they're kind of in the early steps of developing their self-care, and communal operations. So even if your workplace does not officially allow for like breaks, if a colleague comes to you and says, hey, I'm really low on spoons, can you take this patient right now and I will then take your next patient? You can create kind of that communal operation to be able to lean on each other for that purpose. Flexibility versus failure. Okay, so this was the hardest part for me about self-care. I'm a perfectionist. Many of us in helping fields, many of us who have gone through higher education tend to not want to fail. We tend to be high achievers. The thing about self-care is if you're looking at it in terms of failure or success, you will fail. You will fail all the time. And it's going to hurt a lot. But if we can look at it in terms of flexibility, we can always do it differently tomorrow. As an example from my life, I had several family situations go on this week that kept me from doing a lot of my normal self-care routines. And by about Thursday afternoon, Friday morning, I realized like, oh, I'm starting to run real low. And I started to feel those feelings of failure. Like, I'm going to wake up Saturday morning and I'm going to be talking to all of these people about self-care. And I've been failing myself this week. And also, I woke up this morning, had my coffee, had my time with my coffee. I made sure I was getting some good sleep last night. I'm going to spend some time with my cats after this. Like, yesterday may not have been great. Today can be great. And keeping that flexible perspective in mind can be helpful. In the packet, there's kind of some more steps about meaning making, but I want to mention it because it's an important piece of self-care, particularly as it relates to grief, is finding meaning through this experience that we've been through the difficult experience. What are lessons we've learned about ourselves, about the world? How have we grown? How have the people around us grown from this experience? And how can I connect to other people about this growth? Again, I keep coming back to the connection because we as humans are wired for connection. And also, it is something we've been robbed of for the last year and a half. So it's something that in these next steps are really, really important to do as much as possible, as safely as possible, as we're kind of rebuilding our world. So rebuilding, bringing everything back together that Nancy and Urmi spoke about, as well as self-care. We all have had communal rituals for grieving. Our families have them, our cultures have them, sometimes our cities have them, that in difficult times, these are the things that we do. And most of those things we haven't been able to do since the pandemic began. So finding ways to identify what are the really meaningful elements of those rituals, what core needs do those elements fulfill for you? Is it connection? Is it remembrance? Is it pride in family, in culture, in community? What are those core needs? And finding safe ways to meet those needs. I'm not going to play the whole video because we are running low, but the video that I wanted to play comes from Italy early in the pandemic. And this whole city was on lockdown. There's a big cultural event that happens in Italy annually that had to be canceled because of the pandemic. It was pretty much canceled last minute because of how bad things were getting very quickly. And this event was important for a lot of people for community pride, for connecting with the community. And there is a song that is sung every year at this event. And so somebody decided to start singing the song outside their window. And then other people along the street came to their window and started singing the song. And finding ways to connect with people over this grief, this loss of this important event that they didn't get to do, this connection they look forward to every year, and still feel connected to their neighbors, still feel connected to that event and that pride of their city, of their community, helped to create what I find to be a really beautiful moment, and is a way of us being able to think about how we can kind of reimagine these rituals in ways that are accessible to us today. So rebuilding our systems and structures. The truth of the matter is basically all of our systems and structures and the things that we used to do in the ways that we used to do them have fallen apart in the last year and a half. I can't think of virtually anything in terms of governmental systems, in terms of school systems, in terms of any sort of structures around my life that look exactly the same as it did pre-pandemic, because it doesn't work for us right now. And the truth of the matter is a lot of them didn't work very well to begin with. So we have an opportunity to rebuild them intentionally in ways that are useful to us to better serve ourselves, better serve our patients, our communities, our families. But we got to do it with intention. So identifying what fell apart, what didn't work, and trying to get creative with what could change, what are the possibilities moving forward. And they can be as wild, as off the wall as you want them to be for now, as we're thinking about what the opportunities are. In terms of like my work life, I would love to be able to have massive group therapy sessions, to teach massive classes of hundreds, maybe thousands of people, to be able to connect them with information they haven't already had before. So finding kind of what possibilities exist, and then looking at what power you have to affect change based upon your level within the institution, your ability to advocate and to organize others to advocate, and then again, connection. Who can we connect with to be able to give us information about how best to serve them, how we can make these changes to be more effective for them, and then who can we connect with to help enact these changes. So as some quick examples of alternative structures, I work in what's called an integrative care setting right now. So we have primary care doctors, we have mental health clinicians, and we have caseworkers all working in the same building in offices next door to each other. So if I have a client, if I have a patient who is talking about some physical health symptoms that are severely impacting their mental health, I can look up their notes from their doctor and see if their doctor is aware of these symptoms. If not, I can go knock on the door next door and say, hey, I'm seeing our mutual patient would you mind stepping in for a quick second and scheduling an appointment with them or talking to them about these symptoms? And so we're able to work more in concert with one another because we are literally under the same roof. So case management on its own helps to connect individuals with community resources. Oftentimes, as mental health practitioners, our patients or clients need other things that we can't help them with. That might be physical health issues. That might be issues relating to housing or other things. So case management helps to connect them with those in a more integrative way. Referral managers are just like giving out lists to patients of existing resources, and then sister facilities kind of helps to share resources, knowledge, sometimes personnel. So I wanted to provide these as a basic idea of what kind of additional structures exist to give you some license for creativity for what might work for you, what might work for your patients and your situation. I'm a grad student, so I did a ton of research and have a lot of sources. And I know I've spent a lot of time talking, but I am available for as long as anybody wants to chat and ask questions. So please, if you have questions that have not gotten answered yet, please share them. I would like to make sure everybody walks away with this feeling like you can do at least a little bit more self-care for yourself. You know, it's always awkward kind of sitting at the end of those sessions where everybody's questioning, do I want to be the first person to ask the question? Do I not want to be the first person to ask the question? There we go. Are worksheets available? Yes. I will drop the link to the Google Doc for the worksheets again for you so that you have access to it if you were not here at the very, very beginning of the session when I dropped that link originally.
Summer, maybe I can ask the first question to get us all warmed up. Is that okay?
Yeah.
Okay. So, so I guess my question is, as I was hearing you present on this topic, it's so important, and thank you so much for an incredible presentation. It was so lively and so many little things that we don't think about, right? So I guess my question is, there are things that are within our control that we can do, which is what you shared so much of. And then there are things that are not, like systems that we cannot change, that create these conditions that that make us burn out quicker, or we struggle with compassion fatigue because we're giving so much of us. Do you have any advice for us in how to think about this or how to approach it? Because it's one of the, we can do so many of the things that we can control, but then when we have these structures that sort of are designed to suck everything out of us, then what do you do, So I don't know if you had some thoughts about that. I would love to hear your perspective.
Yeah, so the first thing is realizing that all of us actually have more power than we think we do. It's just finding where that power is. So that's why I gave in the idea of creating a community of self-care, both a top-down approach and a bottom-up approach. Because not all of us are up at the top of our kind of administration where we are able to directly affect change, but we can all kind of work with our peers to being able to create some of this community, some of this connection, to create these cultures of self-care, of managing these difficult and sometimes counterproductive systems that we have to operate in. So identifying your level of control and then connecting with others to help try to build that power that you have and build systems within that level of power that are useful to you. And also advocating to higher levels of power to change the systems that aren't working for you. Because if you're one person going to, say, a hospital administrator and saying, hey, this system doesn't work for me, the hospital administrator is probably going to say, okay, well, too bad. But if it's 50 of you going to the hospital administrator, they're probably going to pay a lot more attention. Same thing with government. If it's one person going to a government official saying, hey, this system doesn't work for us, they're not going to pay attention. If it's 50, 100, 300 people going to that person, they're going to suddenly pay a lot more attention. So identifying where your power is and connecting with others to try to enhance your power. All right, somebody asked a question about resistance to self-care. Yes, okay. So that's why I like to conceptualize self-care as the basic care and feeding of humans, because at its most base level, it is. It's eating, sleeping, moving, and connecting. So breaking it down to people in terms of kind of things they're already doing and the way of just operating and doing it more intentionally in ways that are useful to them can sometimes help to break some of that resistance barrier. And also, modeling is really important to breaking that resistance, because a lot of people just have no idea what self-care can look like beyond go take a bubble bath or something. And so doing it yourself and being vulnerable and open about why you're doing those things, sharing, I'm low on spoons today, or like, you know what, I had my morning cup of coffee and I'm feeling great. I got a lot of spoons. Can I help you out with something? Can help to kind of get people used to the concept of self-care being a normal thing that we all do. Okay, trying to see if I missed any other questions. I don't think I did. How to guide a person to differentiate between self-care and being selfish. Okay. Yeah, people tend to portray an attitude, a body language or tone that indicates that self-care is selfish. And the truth of the matter is, yes, self-care is to a certain extent selfish. Selfishness is not exclusively a bad thing, because we are incapable of being exclusively selfless without also being selfish. It's a balance. So on the whole, as helping professionals, we are likely to be much more selfless, giving of ourselves, than we are to be selfish. But we have to have some sort of balance that works for us. So when other people are giving us an attitude of that is inappropriate, you shouldn't be engaging in those behaviors, one is being able to internally regulate yourself. I know that the things that I am doing are necessary for my basic functioning to be able to do the things and give of myself in the ways that I want to. And finding ways to communicate that to them, that this is not a bad thing, because this is what is necessary for me to be able to be the kind of mother I want to be to my children, to be the kind of therapist I want to be to my clients, to be the kind of human I want to be participating in my community. So finding ways to internally regulate for me has been the most important for kind of when I receive pushback on that self-care, because it does feel threatening to me when people are challenging that and calling me selfish, because it's very uncomfortable. I have a negative connotation to that word. Lots of people have negative connotations to that word. And so finding ways to regulate it and to calmly communicate to the other person that, like, this is just a necessary part of being a human and of being able to give in the way that I want to. Does that make sense? Does that at least sound like a start for the individual who asked that, Priya? Okay. Awesome. What other questions? I'm glad to stay here. If you all need to go, I recognize we're officially out of time, but I'm glad to answer questions if people need them.
Maybe at this time I can make a request to Matt. I'm sorry, I have a lot of noise in my household right now. So maybe we can stop recording so that we can people can feel free to share without it being on record. Thank you. And I don't know if we can pause live streaming as well, but maybe, I don't know, Akanksha, if you wanted to share about the de-escalation training coming up this week.
Uma, I can talk about the coming training.
And then whoever decides to stay, please stay and join us for the Q&A with Summer for this amazing session. Really. What a privilege. Akanksha, I don't know if you wanted to share.
Yeah. I think, Uma, you'll be sharing the next upcoming training program, right?
Oh, okay. Yes, I'm happy to, if you can hear me, because I have a lot of noise happening. But
yeah, you're audible, yeah.
Okay, so this is our, thank you, Dr. Tharlochan, for sharing the de-escalation training course. This is a 5-day online certification on de-escalation. Just to give you a flavor for what de-escalation is, a lot of the times as mental health professionals or even physicians, we encounter individuals or people, family members, situations where people can get very upset with the work that we're doing, or they're upset about the loss, but it comes out on us. And all of those situations are very complicated and difficult. So this is a training on how to manage some of those situations, the kinds of things you can think about to make sure that you're safe and the situation you're in is well managed. And Deborah, I keep saying doctor, because to me, she's such an expert. Deborah Horowitz is an incredible trainer. She has been doing this for many years. And she's going to be doing this 5-session training, including topics such as understanding the violence, the neurobiology around the trauma, the brain's fight and flight, violence and risk assessment, even professional skills. We did a session in the end of July with her, which focused on, actually it might have been in August, but it focused on the environmental factors, what you can change in your environment. That was, so eye-opening for me. So I hope that you will be able to join us for this session. It is really very strategy-oriented, so skill-oriented, as well as some of the conceptualization behind it. So I think it'll be a very rich training. So I hope that you register and you join us. It is for a very nominal fee. I think it's 1,000 rupees for the whole 5 sessions. So I hope that you will share this with your colleagues, and thank you to MAP for organizing this whole session. So we really, really appreciate it. Again, as India, we're a collective of mental health professionals, and we're so thrilled that, and we're a global collective, as you can tell, so we're all over the world. And so we're very happy to be able to share some of our expertise with you.